Hello and welcome to this special show on Rajib television. I am Vishal Dahiya and here we take a stock of India's fight against COVID-19 pandemic and various aspects. Today we're going to talk about Ayush, that is Ayurveda, Yoga, Siddha, Unani and Homeopathy. How these traditional system of medicine have helped in this battle against COVID-19. What are the options available both in terms of boosting the immunity as well as therapeutic options? And for more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Professor Tanuja Manoj Nesari, Director of All India Institute of Ayurveda. We also have with us Dr. Debadatta Nayak. He is a scientist too at Central Council for Research in Homeopathy. And we're also joined by Dr. Rajib Dasgupta, Professor at the Center of Social Medicine and Community Health Social Sciences in Jawaharlal Nehru University. Welcome all of you to Rajya Sabha TV. Let me begin with you, Professor Tanuja, and let's start by understanding the overall concept of Ayush medicines or, the traditional system of medicine and how it helps in the battle against COVID-19.
Yeah, it's a great. The Ayush medicines, especially Ayurveda and Yoga, I mean to say, these are the main objective of these medicines are preventive, promotive and therapeutic. And it is said in Ayurveda that swasthasya swasthya rakshanam aturasya vikara parimoksha. That means to take care of the, to promote the health of the healthy persons and to complete cure the disease. And if we're looking at this corona pandemic, these type of pandemic situations are considered as a janapadodvamsa vyadhi. That means when entire community is being infected because of vitiated vayu, desha, kala and jala, that is airborne, waterborne, and because of the time, season and because of the desha as it has come from the Wuhan. Then in this Janapadodvamsa Vyadhi, there is a treatment protocol which is being used for ages together. We have the traditional wisdom for the treating type of managing such type of pandemic situations. And when it is said that when the entire community is infected, the first thing what we have to do is to clear the environment, to purify the water, air, all those measures which can be done for clearing the environment, purifying the environment, and that's why we do Havana, Homa, Yagya and many other rituals. But the more important that when the community is being infected, then the one who is really like what we can say protected is the one whose immunity is being strengthened. So what the protocol says that the management principle says that to improve the immunity, and so do all such measures which will improve the immunity, and that's why all our immunoboosters like Avla, Giloy, Shatavari, Ashwagandha, Mulethi, all those have been incorporated as a prevention, as a prophylaxis, as a treatment, and again as a restorative health. What we say that post-corona treatment protocol, and I'm really happy that even the Ministry of Health has also included these measures into post-corona management protocol, inclusion of the immunoboosters. Then the second one which I would like to highlight here is all the physical and the local measures which really control and which will prevent the infection, entry of the virus into system. So what are all those measures? The one is a gargling with turmeric, saline, warm water, then the steam inhalation, then the nasal application, instillation of the medicated oil like Anutel, what we have done on 80,000 police personnel. So those are the local measures which really help in preventing the infection to entry of the virus into the system. Once the virus has been entered, then the second measure what we are adopting here as a preventive and treatment also to prevent the replication of the virus into the system and having the anti-inflammatory effect and many others. So that's why the first measure what Ministry of Ayush did was the advisory included the Kadha, Ayush Kadha, with the local measures like even home care measures like cinnamon, ginger, black pepper, tulsi, and the resin. So that immunity kadha also helps. Even adding the haldi also, haldi wala doodh or haldi into that prevents the replication of the virus owing to its antiviral effect. And the third, once the virus has replicated and there is an infection, then main target is to target organ damage, prevent the target organ damage like lung, there is a pneumonitis, then for the heart there is a myositis, and then there are embolus, and then there are chances of the stroke also, cerebral vascular accident. So to prevent the damage to the target organ damage, again we use antioxidants and anti-inflammatory, where again we as a treatment measure we have included mulethi, then giloy along with pippali, and many others like Kala Megha, Andrographis paniculata, and the neem. So I am really happy to share that Ministry of Ayush has initiated and advised all the guidelines for first prevention, prophylaxis, which includes all three measures, local, systemic, and the general. And the third is a treatment guidelines specifically from yoga, from Ayurveda, and from other systems. And now Corona ke saath bhi, baad bhi, how to coexist with the Corona and restore the health. So all those guidelines have been notified, and all of us at All India Institute of Ayurveda also, we are practicing in our COVID health center as a prophylactic measures, and all 11 research protocol trials we have conducted. And Ministry of Ayush, I am really very happy to share that the CTRI, that is a central clinical trial registry, if you look into that, how many clinical trials have been registered on the CTRI, then the maximum trials are from the Ayush Ministry. Like more than 59 clinical trials have been registered. And it is not only Ayurveda, but Ayurveda is creating harmony between mind, body, and soul. So it is the yoga and Ayurveda are the two sides of the single coin. So if you can look into all those advisories, the Ayush has strongly advocated to follow the yoga at least minimum 20 to 30 minutes in a day.
We'll come to the yoga part, Professor Tanuja, a bit later, since you give an exhaustive account of how Ayurveda helps. So let's take it one by one. Let me bring in Dr. Nayak here. Dr. Nayak, on the homeopathy part, this particular system of medicine, as Professor Tanuja was explaining in detail about how Ayurveda helps in various forms, preventive as well as therapeutic. How does homeopathy works out here, specifically in a pandemic situation and against COVID-19 here we are talking about?
Yes, this is a good question. Let me tell brief idea about homeopathy. Homeopathy is a system of medicine which believes in similibus curanta. That means that a similar agent can be given and to cure the disease where similar type of manifestations are observed. So in this case, homeopathy has been extensively used in pandemic epidemics during last 100 years or since its inception. To take here the example of Spanish flu, because there is a lot of comparison at present also to compare with Spanish flu in 1918 with COVID, because it falls around 100 years. And during that time also the death rate was very high, and it is a similar kind of respiratory infection where death is due to respiratory pneumonia, etc. But during that time, there is a lot of use of homeopathy in particularly United States of America, which are most of the published literature says. Around the use of this homeopathy was used both prophylactic as well as for treatment. If you see as per the historical data, the data available, the death rate was around 1 to 2% in homeopathy, where homeopathy was given to the patients along with other things. But if it is not given and only a conventional treatment given at that time, it is not a comparison of conventional treatment present with that time. That 1918 situation to be compared at that time, it is around 30%. And subsequently, if you will see many other pandemics, and during 2009, pandemic of swine flu. Also, homeopathy was extensively used in India, and the papers published. And we have shown that at that time also arsenic alba was given, and it was very highly successful. And we have also conducted clinical trial during that time with homeopathy. We have shown that when the homeopathy was given, it had have a better outcome, early resolution. Coming to the COVID-19, COVID-19 is a new disease per se due to there are modifications in that coronavirus. So at present, as you all we are know that Ministry of Ayush is very proactive, and due to that proactiveness, this Ayush systems they got permissions to undertake research studies. Prophylactic public health advisory has been given by the Ministry of Ayush, and from homeopathy, arsenic from album 30 was given as a prophylactic, and this medicine has been selected based on some of the inherent theoretical background of homeopathy that we tell genus epidemicus. This concept is that after observing a series of patients or their signs, symptoms, and we form a picture of that disease. Then with that picture, I told it believes in similibus. So similar type of drug which has similar type of manifestations. We select that drug as a prophylactic. We tell it is a genus epidemicus. Also, this medicine can be used for treatment. But treatment is very individual basis. At that time, we look for the individual features of every patient and we select a medicine.
Okay. And how effective, Dr. Nayak, the homeopathic form of treatment has been so far vis-a-vis COVID-19, your studies or a particular kind of data your organization or otherwise also would have been collated so far. So effectiveness of homeopathic form of treatment vis-a-vis COVID-19.
Yes, this we have as soon as in March we have started. Almost you can find around in the clinical trial registry there are some 18 studies has been registered. But alone CCRA, Central Council for Research in Homeopathy, has taken 8 studies, and that has both type of studies, both prophylactic studies and treatment studies. In prophylactic study, we have completed 2 studies. One in Delhi, in the containment area, we have given this arsenic album to the persons residing in the containment area, and we have followed them for during last since May 4th we have started that, and we have completed by 9th week we have completed that, and subsequently we are also following them.
Okay,
there is a good response, and the trial analysis is going on, but I can tell this is a very encouraging, and we have got around 76% protection rate in this. And those who have received homeopathic medicine arsenic album.
Okay.
And there are other containment area where we have not given homeopathy medicine, but we have collected data subsequently, and that has compared with this, and this data of what preliminary we are getting, that is in comparison to those who have not received any homeopathic medication. But both the group, there are also some practices of like some people are using sanitary measures, all these things are there. And another trial we have done on a multi-center trial of 7 cities of India, like Chennai, Mumbai, Kolkata, Hyderabad, Delhi, and Surat.
Okay.
There also we have similar, because with this earlier study was only Delhi, so there may be question, it may not have similar bigger effect on other cities, as the virus is a mutable virus.
Okay.
And the result of those, that all these multi-center trial of multiple cities also have similar results, which validates the observation of first study.
Okay, and let me bring in Dr. Rajib Dasgupta here now. Dr. Rajib, as both Dr. Nayak and Professor Tanuja are pointing out, specifically with respect to the Ayurvedic form of medicine and homeopathic form of medicine, and there are, as Dr. Nayak said, historical evidence as well in terms of, this particular form of treatment or medicine working, and the studies, ongoing studies also, supplement that particular evidence. As a public health expert, if you look at situations like, a pandemic or epidemic situations like the one which we are in right now, these form of treatments, this is traditional wisdom. This does add a lot of value in terms of, fighting against the particular disease. And this time around, it's COVID-19.
Yes, no one is questioning the value. The values of these various systems has been well established both by the experts on the panel as well as otherwise. Even in the early epidemics, contributions from other systems such as Siddha are well recognized. The issue is, if we think from the perspective of the viewer or the audience or the Aam Aadmi, so to say, what the Aam Aadmi really needs is a synergy of these systems. Now, what is our expectation? Is the common man to make a choice of systems, be convinced by the respective merits and strengths, or as a patient or as a caregiver or as a family, I would expect that the public health system shall be able to organize, deliver, and make available and accessible a system which synergizes all these, which brings in the best possible of these various systems and make it available. And the issue is that one individual person or patient is not going to access multiple institutions or multiple practitioners. Mm-hmm. And therefore, the public health system it's really the onus on the two ministries, both Ministry of Ayush and Ministry of Health and Family Welfare, to be able to work together and to bring about a synergy of these systems, whether in terms of treatment or in terms of prevention. Now, each ministry, each system is issuing its own guidelines, it's issuing its own advisories, but how do we interpret it at the level of the common man?
Okay. That seemingly is a very important aspect out there, Professor Tanuja. On the synergy part, if we are looking at it, obviously all systems of medicine seems to be contributing a lot, and as Dr. Rajib also said, no one is questioning the traditional wisdom or the value of any of these systems. But the synergy is a really important aspect here. So how do we bring that synergy between these different portfolios of preventive or therapeutic, management vis-a-vis COVID-19?
Yes, it's really a very valid point Dr. Raju has pointed out. But I'm really happy to share that this is the first time that through Health Ministry, the integrative protocol have been notified on 13th September for the post-COVID management. And that says that the best of the best system of each system has been complemented, and for like immune boosting, the Ayush measures have been included, for the physical strength and for the mental strength and anti-stress yoga protocol have been included. So, and for the community and the social public health measure, the existing conventional measures have been included. So this is an integrative protocol where best of the best of each system have been included, and it is like if you look at the national latest education policy, and the policy also, it says that it is in the interest of the public, because India has a vast cultural diversity, and in the public domain also it's the medical pluralism, because we are giving them the best. On their plate there are best things happening, but it is the choice of the people. We have to create our awareness of telling about the best of each pathy, even homeopathy and other Unani, Siddha and other pathis also, and it is the people also, they have to make them the choice which is the best for them. But what is important from all government perspective and all the healthcare, that is we have to really create the awareness about telling about the scientific aspects, about the merits and about the demerits, and how it can be complemented at mind, body and health. That's how the government is also doing, looking at it.
Okay. So
and everything is not, yes.
Yes, please, Professor Tanuja, please complete.
No, I'm just now I wanted to share a success story of the Ayu Raksha project, what we have done at Delhi Police. 80,000 Delhi Police people, we have given that all-inclusive protocol where we have given this Ayurveda, Chavanprash, then the Kadha, then Anutel and Giloy Bhatti. Along with that, we have advocated them to follow the yoga also and the counseling at the public, because that's the greatest, I think, largest cohort in the public health. And it is not only public health, but the public health research, because we have roped in PHFI and pre and post immune status have been also assessed. And what is most interesting, I would like to share here, that the trend line of getting infected daily has come down to 1 digit. And there is as the mortality rate is 1.3 in India, but this is 0.48. So in right inclusion, awareness, counseling, and creating them, telling them about healthy food habits, healthy lifestyle, and the national protocol like following sanitization, masking, physical distancing. It include all together and tell them the best of the best. But more keyword of the success is creating awareness.
Creating awareness is the keyword out there. Let me bring in Dr. Nayak here as well on this aspect. Dr. Nayak, your views on ensuring a synergy between these different portfolios or systems of medicine, because ultimately it's the end user who has to be benefited. That's what the ultimate goal for all the practitioners of all these systems of medicine, be it Ayush or allopathy as well.
This is a very appropriate question in Indian context due to cultural diversity and belief. We have different practices and the popularity of different system in different states. Taking into account in Tamil Nadu, they have Siddha, and if the other systems are practiced because of that belief and cultural health behavior. So but thing is that if you will see, the government has taken some of the necessary steps, taking into account, if you will take the last national health policy. So it tells about the integrative approach to the diseases. And
okay.
Am I audible?
Okay. Yes, we can hear you, Dr. Nayak.
So that is that the cafeteria approach has been propagated by our this government, where let the people decide what as per their belief, and this so that there can be a different like under this this government has initiatives, health wellness clinics, where all the Ayush systems along with modern medicine will be available.
So integrated approach and creating awareness are the keywords here. Dr. Rajib, would you agree to this in your concluding comments, that the way we are looking at it, because you started with this point that synergy is a real important issue here, and that is what Professor Tanuja as well as Dr. Nayak is also accepting. But the way forward is to create awareness for the common man as well. They also need to understand what are the benefits of different forms of medicines. One might be used as a preventive sort of mechanism, and the other therapeutic.
The current challenge as far as the Indian context goes is that the cumulative cases is 50 lakhs or 5 million plus, but more worryingly, the active cases is 10 lakh or 1 million plus now as we speak. Second, the mortality rate on the aggregate looks comfortable, but there are states such as Maharashtra, Punjab, where it is close to 4%, which is the WHO benchmark. There are districts, both industrialized districts in, say, a state like Punjab, or predominantly rural districts in a state like Maharashtra, where mortality rate is 4 to 5%, or even in some cases a little above 5%.
Okay.
The point is that now it is increasingly spread to smaller towns and to rural areas, where health systems are relatively weaker than a Mumbai or a Delhi or a Bangalore, and therefore there's a need both to reach out to a wider net of practitioners, which should definitely include all Ayush practitioners, just like all Western medicine practitioners, both in the public and private systems. How will the government leverage the very large private network of Ayush as well as allopathic practitioners? And secondly, the integrative approach, or the plural approach that we are talking of, some distinction has to be made between a pluralism in, if I may, peacetime or a non-pandemic situation, and an integrative approach in a pandemic situation. That really is the challenge of the public health thinking at this point,
Okay.
and being able to organize it and empowering the local health authorities. In fact, the mantra that's been used in UK is as local as possible, with logistic and technical support from state and central apparatus.
Okay.
So how do we actually empower thinking as local as possible, and we bring these multiple systems, and the systems, let's remember, are at varying strengths at various in various districts and in various parts of the country. So there's a varying strength. The cafeteria approach is not the same in all states or in all regions. In reality, the so-called cafeteria is actually limited when one takes a regional approach or even a sub-regional district approach to it.
Okay.
In other words, we are now moving to a different level of challenge, and one hopes that the preparatory foundational work that has been going on in both these ministries will be put to practical use and practical application as the pandemic progresses.
Okay, definitely. There it is. Thank you so much, Dr. Rajib, Dr. Nayak, and Professor Tanuja for sharing your time and views with us and our viewers. So this is all about the Ayush system of medicine, that is Ayurveda, Yoga, Unani, Siddha, as well as Homeopathy. Now, these are traditional system of medicines, and their value system and that wisdom is pretty much established. What is required right now is a synergy or a synergy approach, integrated approach in implementation of these system of medicines, and all stakeholders will have to work in tandem with each other to ensure this. We'll come back again tomorrow with a different topic. Till then, keep watching Rajya Sabha television, and please do not forget to wear a mask when you step out of your houses, as this is the best protection against COVID-19 so far. Thank you.